Hi, I am Dr. Prashanth, consultant intensivist, DRM Hospital, Mysore. Today I am going to talk to you about the acute pulmonary embolism. Where acute pulmonarism is a condition where there is a significant physical blockage in the pulmonary artery which is actually circulating in the lungs. So this is actually one of the emergency condition and it's one of the third leading cause of death all over the world. So what is actually pulmonary embolism and what are the risk factors for pulmonarism and how it will manifest, how we should identify and how we should prevent. About this I am going to talk. So basically pulmonary embolism and starts from the clot which occurs commonly in the legs. So there will be a clot which get dislodged and get lodged in the pulmonary circulation, which obstructs the circulation and obstructs the right heart output, and it causes the enlargement of the right side of the heart, which compresses and causes collapse of the patient. Acute pulmonary embolism is a condition where the blood clot will get dislodged and get blocked in the pulmonary circulation. Because of it, a sudden hemodynamic collapse and the patient will have a death. Who are the patient who can get pulmonary embolism? Who are the patient who have risk of it is the patient who is morbidly obese, the patient who is having a diabetic or high blood pressure, and a patient with already previously had or family history of pulmonary embolism, or a patient who is having a prolonged immobility. Example usually commonly we see is a polytrauma patient who got operated and will be immobilized for a prolonged period. And sometimes you can see in the patients who have a long travel kind of in a flight and a long period of travel with immobility. These also are the patients who can usually get the pulmonary embolism. We have a risk of pulmonary embolism is usually they will have as I told before, usually the clots will be start from the legs. So the patient usually present with leg pain, leg swelling and mild fever, and if it progresses he will present with breathing difficulty and giddiness and all. So it is a time actually we should consult hospitals immediately. And how we diagnose pulmonary embolism is with the physical examination and some diagnostic check. In the physical examination, we can make out the patient will be having sometimes with breathing difficulty, where his oxygen level will be reduced, and the heart rate when we monitor it will be irregular. So some of the diagnostics tests we will do which helps us to diagnose immediately. First step is ECG, where in ECG we can see the patient heart rate will be very high and very irregular, and in echo if we see the patient the right side of the heart will be dilated, which is compressing the left side of the heart. And to know its definitive diagnosis, we will do a CT pulmonary angiogram, which shows the amount of clot is there and which helps us to diagnose and also to decide the treatment. So coming to the treatment, it's a kind of emergency where once we have a diagnosis, we should immediately treat it. So there is a lot of drugs, like a blood thinners, which is called thrombolytics. If it is which has to be given. One example is injection alteplase, where 100 mg should be given over 2 hours. Then it should be continued by anticoagulants, which is like heparin and all. So if already patient is having a BP is very less and having a cardiac arrhythmias and all, we have to give injection tenecteplase depending upon the body weight, which we can give injection within 5 seconds. So then it has to be followed with the anticoagulants for next 2 days. So who are the patient who are risk factors for who is having a risk factors for pulmonarism? How it can be prevented? If I means where the patient who are having a risk factors like prolonged immobilization because of operations and all, they should be usually started on anticoagulants like warfarin, citrom and all, and slowly as early as possible he has to be mobilized. And some patients having a risk of recurrent pulmonary embolism, those are the patients who should be inserted with inferior vena cava filter, which helps us to prevent the clots going and getting lodged in the pulmonarism. Pulmonary embolism, basically, as I told you before, is a third leading cause of death in current world, but still it's a disease where it can be prevented with a early starting of medications which help us to prevent pulmonism, and also early identifications of the symptoms and proper treatment will avoid the life threatening conditions. Thank you.